Hi, this is Dr. Jan, Nurse Mentor, and this is part 1 in my Retention for Nurse Managers series. In this episode, I'm going to talk about why clinical rounding is critical to nurse retention. Let's start the conversation. When nurse managers interact frequently with their nurses, they are building relationships that count. When we prioritize clinical rounding and take our time to build relationships with our nurses, safety, quality and service is enhanced. Spending time with my nursing team is one of my favorite things to do because I get to know them as people first and nurses second. When managers round, they get early warnings of system and process issues that can be fixed quickly. Another benefit of clinical rounding is the ability to capture amazing stories about nurses going above and beyond for our patients and team. This means we can reward and recognize our nurses frequently and in the moment. During clinical rounding, I learned about an extraordinary nurse who cared for a man with burns to his hands after a bonfire set his blanket on fire. The man was unhoused after losing his job 6 months before. He had only the clothes he was wearing. Most had been cut off and the rest were unwearable. While in hospital, he had one visitor, the nurse who had cared for him in the emergency room. The day before his discharge to a shelter, the emergency room nurse gave the patient a gift: 2 sets of pants, underwear, socks, t-shirts, a sweater, a winter jacket, a pair of shoes, toiletries, and a $50 gift card, all placed in a new backpack. Nurses do exceptional things every day that often go unnoticed. As leaders, it's our job to capture and highlight these stories so that we can celebrate the work that nurses do. If you commit to rounding frequently on your nurses, you will see improvement in your nurse engagement and retention and be able to celebrate your team in the moment. My recommendation is to schedule frequent rounding on your calendar. Don't forget your night shift. No agenda. Leave the clipboard behind. Get off script. Sit down and listen, and get the nurses used to seeing you in the units. Be responsive when they tell you about a problem, and hit every unit or area of responsibility. Stay tuned for part 2 of my Retention for Nurse Managers series and why regular one-on-one meetings are critical to nurse retention. If you want to see more videos like this, click like and subscribe, comment and share, and I'll see you soon.